Assalamualaikum and hi. Today our group will be reviewing an article which is radiation in medical practice and health effects of radiation. With safe use and prevention of overuse, the medical community plays a critical role in restoring and protecting health through radiation. It is critical to monitor trends and handle radiation concerns, especially for children and pediatric patients. Effective preventive strategies can be provided by primary care physician and family practitioner. There are two types of radiation, which is ionizing and non-ionizing. Ionizing radiation is used extensively in health, industry, agriculture, and research. However, increased use demands safe use policy and precaution. The population radiation dosage contribution from all artificial medical sources is 98%, accounting for 20% of overall population exposure. For 3,600 million diagnostic radiological examination, 37 million nuclear medicine operation, and 7.5 million radiation treatments are performed each year around the world. Radiation is not used in all medical imaging, and radiation that harms to tissue and organ is dose-dependent. The equivalent dose is a measure of biological effect based on the amount of absorbed dose and the sensitivity of the living cells to various types of radiation. Acute harm from high equivalent doses may include skin redness, hair loss, radiation burns, and acute radiation sickness. The long-term risk of cancer is proportional to the radiation dose. Ionizing radiation exposure during pregnancy may cause brain damage in the fetus, but human investigations have found no effect before or after week 8 or 25 of pregnancy.
Risk reduction strategies, rational use, and reduce exposure. According to this journal, to reduce the risk of radiation exposure, the following strategies can be implemented. Firstly, limited use of radio imaging. Radio imaging should only be employed when it is absolutely necessary. Physicians should carefully consider the need for imaging and choose the appropriate modality. MRI is preferable to CT as it can detect more abnormalities without using ionizing radiation. Secondly, restricting CT scanning range. CT scans contribute significantly to radiation exposure, so it is crucial to limit the scanning range to the area clinically indicated. Radiologists should utilize the lowest possible radiation parameters, reducing doses by up to 50% if appropriate, without compromising diagnostic accuracy. Radiation therapy. In this journal, it already mentioned that there are some important facts about radiation therapy. Firstly, more than half of all cancer patients receive radiotherapy as part of their treatment. Radiotherapy is used in the treatment of various cancers, including squamous and basal cell types, prostate cancer, non-small cell lung cancer, cervical cancer, head and neck cancers, Hodgkin's lymphoma, and low-grade non-Hodgkin lymphoma. Certain cancers, such as Hodgkin lymphoma and low-grade non-Hodgkin lymphoma, can be effectively cured with early administrations of radiotherapy. Delivery of radiotherapy requires a high level of technical expertise. A qualified and competent team consisting of clinicians, medical physicists, and radiation technologists is necessary to ensure the safe and effective provisions of radiotherapy services.
Now, we move on to radiation emergency. Radiation emergencies involve non-routine situations requiring prompt action to mitigate risk. Gastric lavage technique empties stomach of toxic substances through sequential administration and aspiration via orogastric tube. Next is early administration of stable iodine compounds for radioactive iodine contamination prevention. In addition, chelation therapy should be used for transuranic elements internal contamination. Next is dilation therapy is useful in cases of contamination with tritium. Next, we move on to the non-ionizing radiation explanation. Radio waves are a type of electromagnetic radiation with the longest wavelengths in the electromagnetic spectrum. Some examples of radio waves is mobile phone. Mobile phone has low frequencies and the energy is absorbed by the skin. Short-term effects on human is there is no consistent evidence of adverse health effect on human. Meanwhile, long-term effect research studying mostly about brain tumors and mobile phone use. Next is microwave. Microwave is a form of electromagnetic radiation with wavelengths ranging from about 1 meter to 1 millimeter. Microwave can be absorbed by the body. It produces heat in exposed tissues. Risk of heat damage is in those organs which have a poor blood supply and temperature control. However, the thermal damage would occur only from long exposure to very high power levels. Lastly is UV radiation. Ultraviolet is a form of electromagnetic radiation with wavelengths shorter than that of visible lights, but longer than X-rays. There are three classifications of UV radiation, which is first UVC, effectively blocked by the Earth's atmosphere. Next is UVB, forms a small component of ambient UV radiation. Lastly is UVA, the dominant waveband found at the Earth's surface. The effects on overexposure to UV radiation is harmful effects on the skin, eye, and immune systems, and also it can cause skin cancer. UV level increase with altitude by 10 to 12%, causing greater intensity in tropics due to direct sun rays. Strategies for UV protection is first, limit exposure in the midday sun. Next is use shade wisely. Next is wear protective clothing and eye protection.
Hence, humanity should profit from technological advancement which demand more professionalism, safety precaution, and evidence-based investigation in medical contexts. Continuous practice is required for efficiency and precision.